Our newsroom inbox has been full of emails about the sudden closure of a fertility clinic here in town that serves patients from all across the country. Our Hannah McDonald has been in touch with dozens of you who've come here to Nashville for expensive and time-sensitive treatments. And we're committed to making sense of all this, so Hannah set out to learn more about what people caught in limbo can do.
At this point, I've really lost count of the number of emails I've received about the sudden closure of this fertility clinic. I was stunned that so many people found out about the closure through my reporting, and that's why I'm trying to do as much as I can to get help to these patients.
If you are a current patient, please read the important notice here.
It took almost 2 weeks for the Nashville Center for Reproductive Health to post that it closed. Nicole Hayes first went to the fertility clinic back in November.
And the reviews looked good, so I decided to go with them.
Overall, Nicole's experience wasn't great, and her very last appointment was the day before the abrupt closure. It was with Dr. Jaime Vasquez, who's run the clinic since 1995.
There were very long periods of silence because it was literally like he was trying to figure out what to do or what to say.
In a letter I got my hands on, the staff was told the clinic was closing due to unforeseen circumstances that led to a financial deficit.
Yeah.
Nicole and dozens of others are struggling to get their own answers. I talked to a lawyer last week about their legal options, and now I know the state attorney general's office is looking into the matter and wants to hear from patients. People can also submit forms to health licensure boards. That could lead to action against anyone at the clinic if they did something wrong.
I have been paying out of pocket for the few times that I've been in there and the procedures that I've had done.
For someone like Nicole, who at 42 wants to have a baby with her partner, setbacks like this are costly in more ways than one.
It was very much we need to know what's going on and know what's going on quickly with my body so that we can start planning during those times when I'm ovulating. And that just felt like the 4 months was very much a waste of time.
In Nashville, Hannah McDonald, News Channel 5.
Thanks, Hannah. Great work. We're going to put links to those forms for you on our website. There's also at least one fertility clinic locally offering to help patients who've been caught in the middle of all this. That information also on newschannel5.com. You know, fertility treatments are not only emotionally and physically taxing, as we mentioned, they are expensive. I looked up some data. According to Forbes, a single IVF cycle can range between $15,000 and $30,000. That's each, depending on which center you use and what medications you need. There are ways to lower these costs, including checking with your insurance company to see what procedures, if any, might be covered. There are also grants, discount programs, and clinical studies that can help certain patients pay for all or part of the process.